2006 I had surgery for colon cancer and recovered quite well from that. This year I went into hospital for some remedial work on a hernia, and unfortunately the surgery needed to have remedial work and a second lot. So that was my experience. It was straightforward. The instructions were clear, and I had the usual preparation to empty my inside so that I'd be nice and clean and ready for the operation.
Can you tell us something about the preload? What we asked you to do with it?
Yeah, I have bad memories of Fleet for the first operation, but the second one wasn't so bad, and it did the thing that it was meant to do.
Okay.
And again, just following instructions, very easy.
Yeah.
Yes, the night before I was admitted for surgery, I came in for an injection, which was the Colorectal injection, which was not at all problematic to me at all. Yeah, I was given the opportunity to eat something at 3 a.m. in the morning, but I declined that and opted for sleep. When I came into hospital for surgery, there was a busyness about the day, but everything seemed in good order. I saw the anaesthetist, who questioned me at length, and I felt that everything was being done as should be. I didn't feel rushed, I didn't feel harassed in any way, and neither did I feel anxious, which sometimes people do feel with operations. But having been in the hands of the hospital before, it was not unfamiliar ground. Yes. After surgery, I remember coming around in the recovery room, first of all, and felt extremely woozy for a good hour or so afterwards, and then gradually back on the ward I just recovered and felt very comfortable. I had no pain and no discomfort to talk of at that stage. I don't think I did have any nausea or any after effects at all. It was just a peaceful coming around from the anaesthesia, I think. Certainly, yes, on the day of the surgery I had something to eat, I remember, yeah. I didn't have a catheter, and I was relieved for that. Following surgery, the day after and the days that followed, I was encouraged to get out of bed and move, as this would aid my recovery. Although I was eating, I wasn't relishing food, and it wasn't long before the stoma was working, but slowly, because 4 days later I needed to go back for more surgery. But the encouragement I got to eat and to exercise was good, because the more I exercised, the better I felt. Pain-wise, that was kept under control. I've no bad memories of bad pain, so that was good. On the day of discharge, it was like ending of a sentence for me. I'd been in hospital quite a long time. Everybody was very careful to make sure I had all that I needed for returning home. I felt happy about returning home and glad to be on my way. Advice was given, medication was supplied, and I felt fairly confident to go home, and with the rider that if anything did go wrong, I could return to the hospital, to return to the ward. So that was good. The first few days at home were without any real problems. District nurses came the first day, which was helpful. I also knew that Suzanne would be available to me if I needed her. I got telephone numbers to ring, and so I had no anxiety in that way whatsoever. My big concern was just getting my weight back and eating better. So in every way, the discharge process was good for me. Yeah.